You're listening to Parents You've Got This, the expert guide to parenthood. The complete guide to pregnancy, birth, baby and parenthood.
This week on the Expert Guide to Parenthood podcast, we're talking all about safeguarding your family. We're talking about egg freezing with our IVF and Fertility Expert, Dr. Rachael Knight.
Dr. Rachael Knight works at Life Fertility Melbourne, and she has a wealth of experience in helping families to achieve their dream of having little people. She has more than 20 years of experience, and she has advanced endocrinology training and gynecological training. She is just the best of the best, and we are so lucky to have her on the Parents You've Got This expert team. Thank you so much, Rachael, for being with us today.
Thank you, Christy and Freya, for having me along. It's exciting to be here to talk about parenthood and what we can do to preserve fertility and assist people along this path.
It is one of the questions that we are always being asked, and in a professional capacity as part of Parents You've Got This, but also in a personal capacity with friends that are, they maybe haven't met their partner yet, or they're not sure whether or not they're ready to take that next step, but they're aware that they should be learning about egg freezing. And we're really grateful to you today for explaining to us what it is and how it all works. So perhaps if we start at the beginning, what is egg freezing?
Egg freezing is a technique that we employ in fertility clinics to freeze eggs so that we can use the unutilised eggs when we're a bit younger and then go back to them later if we need them, if we're struggling with our fertility and we're having some difficulties. It potentially preserves our chance of being a parent later in life if we're not ready right now.
And would everyone consider egg freezing? Like what would be some of the factors that we'd consider to freeze our eggs?
The main factor is if you're not wanting to fall pregnant straight away. And for a number of people, this isn't an option. Either they don't have a partner, they're pursuing their path with study, with work or career opportunities or travel, or they're just not sure whether they want to be a mum or not. And that is a decision that they don't want the door closed. They want to have that opportunity potentially for the future.
And so what does the process entail? Is it a big decision to get your eggs frozen? What's involved in it?
What essentially is involved is putting people through the first part of their IVF cycle, which we tailor so that we reduce and minimise side effects for them and work in around their other commitments or other aspects of their life that are putting them to egg freeze in the first place. For some people, it's an emergency. They might be freezing their eggs for medical reasons, such as a diagnosis of a cancer or a tumour where they need to have surgery or chemotherapy that could potentially damage their fertility. We can then freeze eggs in that situation quite quickly. What the treatment involves with regards to the process is medication, some monitoring and also an egg collection procedure.
And how are the eggs stored? So once you've got your eggs, how are they stored and how long are they stored for?
Once you've got your eggs, what we do is we snap freeze them in a process called vitrification, and this freezes them in a glass-like state. They can stay frozen for up to 10 years in Victoria.
Wow.
They are frozen at minus 196 degrees and they don't go off in the freezer like meat, and they have probably a long lifespan. However, the legislation in Victoria is such that you do need to apply if you want to keep them for longer than 10 years at a time.
So that said, Rachael, what is the optimal age to freeze your eggs?
Studies have shown that the optimal age to freeze your eggs is between 30 and 33. Freezing your eggs in your early 30s gives you by far the best chance of success should you need to go back to your eggs later. And unfortunately, 15% of people over the age of 35 have difficulties falling pregnant. But you don't know who you are, and neither do we. We don't have a good way of predicting who's going to be in that percentage that are going to really struggle to fall pregnant. So if you've got eggs frozen, you can go back to use them. However, if you freeze them too early, you may not need them. And less than 10% of people who freeze their eggs in their 20s will go back to use their eggs. Yeah, okay. So the age between 30 and 33 has been shown to be around the ideal age. people still do freeze their eggs when they're 40, getting close to 40, and sometimes even after 40. However, that would be more in exceptional circumstances if there are no other options. The problem with freezing eggs at 40 is that to give yourself a really decent chance of having a baby from your frozen eggs, you need to have a lot of eggs, and that is often very, very difficult to achieve.
Yeah, and I love this conversation. It's about safeguarding your families, right? And one of my friends, I won't say her name, but I'm just so overjoyed for her because she's well into her 40s and she's had a baby, but she froze her eggs when she was younger because she had quite an extensive career. And for her, she's actually chosen to become a parent by herself, and she's doing such a fantastic job. She's got a beautiful baby, and I don't think that would have been possible if she hadn't frozen them when she was younger.
Yes.
And she talked a lot about lifestyle factors to increase the quality of your eggs. So what do you suggest people do if they're going to get their eggs frozen? What do they do to make good quality eggs to freeze?
Yes, well, firstly, the most important factor that influences egg quality is age. And unfortunately, there's not a lot that we can do or take that will influence the quality of our eggs. There are a lot of things that we can do, however, that will reduce the quality of our eggs. So to keep our eggs at the optimal quality is to have a good, healthy lifestyle, to reduce or stop things such as smoking, vaping, recreational drugs, alcohol intake, maintaining a really healthy lifestyle so that the eggs are not negatively impacted by some of those things. And I guess the second thing to say after your last comment is that unfortunately egg freezing doesn't work for everybody.
Yes.
Who go back to use their eggs. If you freeze your eggs under the age of 35, you have at least a 70% chance of live birth from those eggs, although it may take more than one cycle of treatment to be able to obtain enough eggs to provide that good chance of success.
And do things like exercise impact the quality of your eggs? Can you do lots of exercise, or is there a certain amount you should be doing?
Exercise is really about having a healthy lifestyle. So exercise is going to be recommended, probably not too much exercise, as that can have other adverse outcomes on maybe the number of eggs that we may be able to retrieve, but exercise is recommended at least 4 times a week to enhance a healthy lifestyle. And all of these things are important in the lead up, particularly the 3-month period prior to having your eggs collected.
So Rachel, what is the process of that then? So if someone wants to get their eggs collected, can they come to Life Fertility Melbourne, which is a beautiful space and a really amazing, welcoming, nurturing place to be, and meet with yourself to get an understanding of the process, or do they book in and they get it done that day, or how does that sort of side of it work?
Yeah, the process really involves coming to see us, and we'd be very happy to see people at Life Fertility Melbourne. What we do as part of this process is to arrange an assessment of their fertility when we first see them. And people may then choose several different paths based on the information that they receive. Some people may decide that it is important for them to have a family and they'll start trying to conceive as soon as possible, which will always provide them with their best chance of success. Others may be happy just to have a check on their fertility at that stage, and then other patients or clients that we have will decide to go down the path of egg freezing. And this can be done relatively quickly. However, we usually need approximately 2 to 4 weeks to be able to complete the treatment process. Unfortunately for me, the eggs aren't sitting there just ready to be plucked out. Yeah. I do have to go through a process of developing the eggs to the point that I can retrieve them, and that involves putting someone through the first half of their own IVF cycle. We give them medication to help develop the eggs to a mature stage, which is the point where they can be successfully collected and stored. and this involves injectable medication in most cases. The injections that we use, really people should not be daunted by. They are very small, very fine needles, and our nurses can help with every step of the way. The medication is taken daily, and for most people, they do not have a lot in the way of side effects. Some people do unfortunately get some side effects. They're often not severe or debilitating side effects and include things like headaches, bloating, breast tenderness, some tiredness, sometimes feeling a little bit moody or fragile, just maybe not quite yourself. However, they do disappear fairly quickly once we've done the egg collection procedure. We monitor people while they're undergoing this treatment, and that monitoring phase usually involves ultrasound assessments, occasionally a blood test. And once we determine that there are eggs there ready to be retrieved, we'll organise for an admission to hospital so that we can retrieve the eggs.
And does it matter then if they're frozen or fresh? So we're talking about freezing our eggs to future-proof our families. Is there better chances if they're fresh or frozen? How does that work?
Yes, we in the past had much better success rates with fresh eggs versus frozen eggs. However, with these newer freezing techniques, this vitrification that I was talking about before, we are getting much better success rates. And in fact, there are a number of studies that have reassured us really that the success of fresh eggs versus thawing and utilising frozen eggs is much the same. We will unfortunately have some eggs that won't survive the freeze thawing process, but the majority of them do. I guess just circling back a little bit to the egg collection procedure to give our viewers a small insight into what that entails. I'd just like to go through that for a moment, if that's okay. The egg collection procedure is usually done under sedation, which is similar to having a general anaesthetic, but not quite as heavy. What that means is that you feel like you're going to sleep, you don't feel any discomfort during the procedure, but you do wake up feeling less of a hangover effect as you might after having a longer, heavier general anaesthetic. An anaesthetist would be there looking after you. For most people, it's less than a day in hospital, sometimes even only a few hours, and you're able to go home. One thing to be mindful of in this situation is we have a number of our patients or clients who just like to fly under the radar a little bit with this. You do need to have someone pick you up from hospital and be with you afterwards. We don't like people going home into the care of a taxi driver or Uber driver. That's not ideal.
Well, that's one thing I really love about Life Fertility Melbourne, how you have people that you can talk to about these big decisions, and it is a big decision, but it could be the best decision that you ever make to safeguard your family. So thank you so much, Rachael, for coming on today to talk to us all about egg freezing and about fantastic Life Fertility Melbourne and how you can get those services done there if that's something that you choose to do.
Pleasure. Thank you for having me on.
Thank you, Rachael. You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents,
You've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.